Hi, Dr. Garima here, and today we'll be solving another SBQ based on the Australian exam. And my son is near me today, so there might be some interruptions. Come here, say hi to everybody. I've been keeping talking about you that I have a 2 year old. All right, let's start with the SBQ before he loses his patience and starts to interfere. क्या हुआ बेटा? Good, okay, come sit and you play, and I will just explain, okay? So yeah, this is my life, and I try to take out as much as time I can just to explain. All right. So the question for today is examination of a 32-year-old pregnant woman reveals that she has a generalized periodontal probing depth of 4 to 6 mm. बेटा कुछ नहीं आपको चुपचाप बैठना है और मम्मी को एक्सप्लेन करना है. Most of which bleed on probing. She is otherwise healthy. So it's a 32-year-old. She's pregnant, a woman. A very important key phrase here because a lot of things change when a person is pregnant in the treatment wise, how you are going to handle the patient. And then she's having periodontal probing depth of 4 to 6 mm, meaning she definitely has periodontitis. And most of which are bleeding on probing, but otherwise she seems to be fine. This is nothing. So first question is, which period is considered to be safe to treat a pregnant movement? So irrespective whether she's having pain or she's having a broken tooth or an abscess, etc., uh, which stage of pregnancy she is in would definitely determine whether you're going to treat her on the chair or you're going to refer her to the hospital. Ha, beta. This is nothing. This is just a watch, a digital watch, beta. And this is number. So the first question is, which period is considered to be safe? And we have all read, and I'm sure you must in your practice would have encountered at least one pregnant woman. And the answer is second trimester. So first trimester and third trimester we never take. We always take in second trimester if any treatments to be needed. मम्मी के हाथ में गणपति पप्पा नहीं है. And we always make the patient lay a little towards the left, not exactly full supine, and you will never put her in an absolutely trundle and work position. Ah, beta, this is go. Okay, there is going to be a lot of disturbance in this video, but it's okay now. This is how life is. Okay, how about you take my phone and play? You want to take my phone? Le Papa ka phone se khel ja. Papa ka phone le chalu kara khel. So second trimester is the answer. You will not risk in the third trimester, and if there is something which needs urgent attention and you think the patient is in the third trimester or the first, then you refer in the hospital. Okay, I don't know how to pause this, so I'm just putting a video for him so that he's quiet for 2 minutes. हाँ बेटा अच्छा गणपति पापा लगाती हूँ मैं. ये ले गणपति पापा. There. Go play. Okay. अभी आएगा ये ad के बाद. There. So, yeah. Now you're about to take an occlusal radiograph for her. What can you do the best to protect her from radiation? See, radiographs are never contraindicated in a pregnant patient. If you have to take one, you have to take one. The only time you're going to protect the pregnant patient with a lead apron is when you are directing an occlusal radiograph. Beta wo Ganpati Papa. Occlusal radiograph, basically you're putting the beam on the nose and it's directed towards the body. Then you're going to put a lead apron. बेटा गणपति पापा दीदी के पास है. फोन दीदी के पास जाके दे. दीदी बताएगी गणपति पापा कहाँ जा. So yeah, you're about to take an occlusal radiograph, and what can you do the best to protect her from radiation? So first take in the second trimester. No, you can take it in any trimester. Use leaded drape. Yes, that is true. It's not exactly a बेटा गणपति पापा उधर ही है. दीदी के पास जाके फोन दे दीदी बताएगी गणपति पापा. जा दीदी के पास जा. Postpone the radio exposure until delivery. No, as I said, you can take the radiograph at any point of time. There is no contraindication of taking radiograph in any stage of pregnancy. That is true actually. So what is the best treatment that you can do? So you can use a leaded drape. If this option was not available, then I would have chosen there is no contraindication of taking radiograph in any stage of pregnancy. But the question here is, How would you protect her from radiation? So if the option of taking a leaded drape is there, that is the option I'm going to choose. Though option 4 is not wrong. बेटा इधर ही है ना तुझे कार्टून चाहिए दूसरा गणपति बाबा चाहिए so that's how 2-year olds are. If you have a 2-year old, you know that if you're talking to somebody or doing something, they want all the attention. And that's why I'm not able to shoot a lot of videos when I'm at home and he's awake. Ganpati Bappa dance kar raha hai. So let's move on to the third question. In a case of pregnant dental operator, the fetus should be protected. Same level of protection as a member of the public. That's kind of a right answer. Same level of protection as member of the occupational exposed, which means us. In case we are standing in the room and taking the x-ray, or a person who's shooting an OBG and standing outside the room, there is some amount of radiation exposure always happening. So what the option means is, are you going to give the same protection as the member who's exposing the radiation getting exposed? No radiation exposure is permitted. The fetus has to be treated like any other member of the public, and so he has to be given the same level of protection, that is by leaded drapery, and the dose is 1 millisievert per year. So yes, you. हाँ बेटा इधर ही है गणपति बप्पा. So, in any pregnant woman, you can take X-ray at any stage of her pregnancy, and you can choose to protect her with a leaded apron, especially when you are taking a maxillary occlusal radiograph. She asks, if I don't get proper perinatal treatment, am I more likely to deliver a preterm low birth weight baby? This is Ganpati Bappa. Which type of study design would provide the best answer to her question? Study design. Now, this makes you go to your third year of dentistry, the community dentistry, where you learn prospective studies, cohort studies, systematic reviews. बेटा गणपति पापा इधर ही है देख मम्मी बात कर रही है ना don't yell and scream be quiet for 2-3 minutes please mummy is requesting. So a prospective cohort involving pregnant women, some of whom have periodontal disease and some of whom do not. Not a wrong option. A randomized clinical trial of pregnant women with periodontal disease, some of whom receive periodontal therapy and some of whom do not. Okay. See, a randomized trial is not exactly a very reliable trial. Comparing the rates of preterm low birth babies between women with no risk factors to those with periodontal diseases. Fair enough. A systematic review comparing the risk of delivering preterm low birth weight babies among women with various risk factors, including the presence of periodontal disease. A systematic review in any sort of. Beta Ganpati Papa idhar hi hai. I'm sorry. Next time I'll try to shoot in my clinic. बेटा इधर ही है ऐड आ गई ना मम्मी के पास YouTube प्रीमियम नहीं है हाँ देर अभी गणपति पप्पा आएंगे. So in any type of study, a systematic review is the best one because you have systematically analyzed, you have taken all factors into consideration, you have a control population. And a systematic review also means that you have analyzed lots of studies, cohort, randomized, prospective, all of them, and then you have made a review. So that kind of study is the most reliable one. So if you have to share some kind of review with a patient, you would do so with a systematic one. गणपति पापा चाहिए तो बेटा आ रहे गणपति पापा मम्मी गणपति पापा ये रहे गणपति पापा. Then she comes back after 2 years and asks about toothbrushing and oral hygiene of her baby. What toothpaste do you recommend for her baby? Babies less than 2 year old, usually less than 18 months, you do not recommend a fluoride toothpaste. But then if you have to give, you would give something which has less than 500 ppm. But here the option is not there. बेटा गणपति पापा पहाड़ पे डांस कर रहे हैं. But if you have to give, then you have to choose the least possible option available in the options, and here it is less than 1000. If इधर ये बेटा अपने घर जा रहा है. If in the options there was a option mentioned less than 500, then I would have preferred that one. इधर ही है. So from this sub question, scenario based question, बेटा गणपति पापा घर पे जा रहे हैं, अपने अपनी मम्मी के पास जा रहे हैं और वो चुपचाप जा रहे हैं. Okay, good boy. So from this scenario based question, you have to learn, read more about fluoride, read about the medicines. घर पे जा रहे हैं, ऑफिस जा रहे हैं, ऑफिस जा रहे हैं, गणपति पापा ऑफिस जा रहे हैं. ठीक है. So you have to read more about medicines that can be given to the pregnant woman and then cannot be given, and what you would do if the pregnant patient is having a swelling, requires extraction, requires a root canal treatment, etc. या पानी में गए वो वापस तैर के आ जाएंगे बेटा. गणपति पापा knows how to swim. So definitely in your exam at least 2 questions related to pregnant woman is going to come. Be prepared for that. And now I'll go and just play with him. I rarely get the time to do so actually, amongst the homework and all the clinic stuff and then correcting your answers and answering all your doubts. I'll be starting in my clinic in another 1 hour. So he was awake, so it's difficult to hide from him when he's awake. So I thought, let's shoot a video. It's been a time and give you a glimpse of how my life goes at home, you know. And I'm truly grateful for that. No doubts about it. It's just, it becomes a little challenging to manage, but it's okay. I cope up. You cope up. It's doable. Okay. So have a nice day. Bye bye.